Hi, good morning everyone. Good evening. Welcome to Kare Nursing Agency's Breast Cancer Awareness Day. We have a good day packed with events for you, including a discussion, and we have a wonderful, powerful breast cancer presentation by Miss Anthony. And we have goodies, and you're gonna get your breast exam, and you're also gonna get vital signs screening. Breast cancer diagnosis is a life-threatening event. Breast cancer is one of the most common cancers in women. Second to skin cancer. It is a form of cancer that begins in the breast, then the cells go out of control. Breast cancer often presents as a lump in the breast. However, most lumps in the breast are benign and not cancerous. So don't be alarmed even if you have a lump, because it can be nothing, okay? Early detection of breast cancer is key. It's a key component of treatment. Being aware of any changes in the breast can help in early diagnosis. The symptoms of breast cancer vary from person to person, so don't assume that because this person is having those symptoms and you're not, that it's safe or otherwise. Have it checked. A new lump in the breast, swelling, skin dimpling, all these stuff, nipple retraction, redness. Miss Anthony gonna go more into that. If you're suspected of having cancer or any changes with the breast, we recommend that you come and get tested, whether it's here, any institution that is offering screening, or by your personal doctor or gynecologist. And ultrasound is what they use beside testing, diagnostic mammogram, and MRI, and biopsy. These are all the testing methods that we use in St. Kitts, and that's available to us here. There are many different types of breast cancer, so please stay tuned and you'll get a little more. Ms. Anthony?
Thank you. Good morning, everyone. It is a privilege to be a part of Kare Nursing Agency again. What I like about Kare Nursing Agency is they're not just a business that offers care as a service, but they are a business that offers care for the development of St. Kitts and Nevis, for the well-being of everyone. And I want to thank Keisha and her team for the opportunity to be a part of this awesome Pinkify month, Pink Power, power to women, power to survivors, and getting the facts and the know-how to make yourself more aware and more in control of the beautiful ladies that we wear on our chest or breast. So we need to know the facts. There are myths and there are facts. And the fact is that last year we had a significant number of deaths globally from breast cancer. You're talking about over 680,000 women died from breast cancer. And this year we're estimating that 43,000 more women will die, and men to a lesser extent. Now, while we target women in the month of October, the truth is men are affected too. Like 1 in 1,000 men will have breast cancer sometime throughout his lifetime. And from our picture graph here, we can see that over the evolution of time, it has become more common, 1 in 8 versus 1 in 11 in 1975. What this tells us is that more women are being diagnosed with breast cancer. There are several contributor factors. One, the women population has gone up, yes. Women are seeing physicians more, yes. Women are more aware and we are checking ourselves, yes. But the environment has changed significantly as well. What we eat, our body compositions has changed. All these are contributing to the increase in the number of women that are diagnosed with breast cancer annually. There is some racial disparities as it relates to breast cancer and death. There is equal among those who are Caucasian and those who are of African descent. But what we find is that more women of color die from breast cancer. And this is related to the inequities as it relates to care that is given to them. While a Caucasian has health insurance and will seek health care, we are a bit more resistant to it. We're not as active, and the access to care and the quality of care is not equal. I pull on the American Society, for example. If you watch CNN, you hear the arguments all the time about health care and access to health care. And this is one condition that shows the inequities as it relates to healthcare. Here in St. Kitts, we can boast to some extent that we have equity when it comes to healthcare. Everyone has the opportunity to visit the health center, to see the nurse, to see the practitioner in the health center, and to get your screenings done. There is no disparity when you go in the hospital and you're diagnosed. You have access to a surgeon, you have access to the counselor, you have access to the nutritionist, because at the end of the day, it's not about removing the lumps, it's not about removing the breast and leave it there. It's the whole picture that comes in for caring for the individual. So at least we can boast about that here in St. Kitts, so that's a good thing. Recurrence is a fact. There's an estimated 20 to 30% of women who, once they've been diagnosed and treated and declared free of breast cancer, have some sort of recurrence. Now, the recurrence may not be in the other breast, but it can be in other parts of the body. You know, the Bible talks about the body and the linkage system of the body. The head can't function without the fingers, and the fingers can't function without the head. There's a connection system with our breast and the rest of the body through our lymphatic system. And if a piece of that cancerous tissue gets into that system, it can move from the breast to somewhere else in the body. So there is some evidence that at least 1/3 of women who have been diagnosed with breast cancer have their treatments declared free somewhere 5 years down the line.